Welcome to StartUpHealth TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. I'm here with Sanji Silva from Mocingbird. Sanji, thanks for joining me.
Thank you, Logan, for having me.
So you are innovating in physician credentialing, and so I want you to just give me the pitch. What is Mocingbird?
Yeah, so Mocingbird was co-founded by two seasoned clinicians trying to take the chaos and the administrative burden out of credential management, because every state, every board certification has continuing education, and they're all different timelines. So what we did is we automated the end-to-end process when it comes to continuing education itself. We create a nice dashboard that's customized to the clinician, which tells you exactly what you need to do when, so that you don't have to guess anymore.
Yeah. You and I have talked about this before, but because my father's a physician, and I've seen him deal with CME.
Yeah.
It's a world that you wouldn't really know or care about if you weren't a physician or had someone in your family. So help me put a human face on this. What's the toll of an archaic credentialing system?
Yeah, so the toll is, especially with telemedicine now, a lot of clinicians are getting 20, 30 state licenses. Actually, we have clinicians who have 50 plus DC, so 51 state licenses. They all expire at different timelines, and we have clinicians who say, hey, I took that course, I took the human trafficking course, but the reality is they took a human trafficking course, but it wasn't the very particular course that state wanted the clinician to take, and who has time to keep up with all of this, right? And our co-founder spent an entire Memorial Day weekend. We like to talk about this. He knew he had to do CME, but didn't realize how much he had to do.
Right.
Just that. So it's this last minute scrambling, and we want to get away from that.
Yeah, and it's not just about missing out on Memorial Day weekend. We're in a workforce crisis. So
Yes.
Talk to me about how better credentialing feeds into fixing some of those problems.
Yeah, absolutely. So we all know that with the pandemic, the effectiveness of telemedicine has been proven. And even payers, we talk to payers, they say, we want to increase capacity. How do you do that? There are a lot of our existing clients actually are the ones who have embraced telemedicine. So they want the clinicians to get more and more licenses, but it's an operational problem from a scheduling perspective that they're trying to solve. But the clinicians say, no, I need infrastructure, I need help. And so that's where we come in. And you take states out of the picture, but stroke is an example. We just last week I was talking to an administrator who has spent years learning this stuff, and she's like, "Yeah, it's clear as mud what counts towards stroke," because again, there's no standard, so to say, because even if you go take a course, it's not very clear. Does this actually count towards stroke? Will the accrediting body accept it?
Now, how does your platform bleed into that area? Because there's just the dashboard of here's what I did, my
Yes.
CME,
Yeah.
and then there's the accreditation piece you're talking about that's
Yeah.
much more complicated.
Yeah, no, that's a great question, Logan. So the early few years we spent creating what we call a rules engine. It's patent pending. We really did the work, the research to put the infrastructure in place. So now we have the rules. But additionally, we say to the clinician, you take the course, you go to a conference, just upload the certificate for us, upload the transcript for us. So we can extract all that data, and this is, we have been training an AI model to not just extract the data, but learn, because every certificate is also different. They don't all look the same, and then we can map that data against the requirements. We do calculations behind the scenes through this rules engine, and we can automatically update the dashboard. So the clinician all they have to do is do the learning, take the course, and upload the evidence.
Where are you at in the sort of evolution of the product?
Yeah, so automation is kind of our theme this year. With this data extraction piece, for example, that I mentioned, we've had a lot of growth in terms of users, clients, and we're getting tens and thousands of files. So It's not a fully automatable process, but we're doing what we can and we're iterating on it. Every week, every month, we're training this model to extract data to know, oh, does it then map against these requirements? So that's one kind of big focus.
How has the market responded to the offer?
It's been great because as more clinicians are getting more licenses, these administrators who are supporting them really are figuring out, we can't do this. They're living in spreadsheets. It's not up to date. The rules are changing. The timelines are changing. Just recently, we had to go change what the expiration date for New Hampshire is going to be because, they decided it's going to change. So that type of thing. It's been great. And the other thing I'll mention is we take security very seriously. Last year, we got our SOC 2 Type 2 compliance certification. So that also just unlocks this. The sales cycle is very long still. And so having that certification, making sure that we are secure, makes us get our solution out to the hands of clinicians that much faster.
Is there a strong cybersecurity concern among hospitals when it comes to credentialing and
Absolutely. The reality is we don't even touch PHI. It doesn't matter. It's a solution that's going into a health system. And I think that's the right thing to do in today's day and age. So just security has become, the SOC 2 certification has become table stakes, I would say.
Yeah. Paint me a picture where you hope to be 5-10 years from now. Mocingbird has scaled the way that you know and dream it could be. How is a physician's life different, and how is kind of the workforce challenges that a hospital is facing? How are they thinking differently about them?
Yeah, I think 5-10 years. Today, when I talk to a clinician, they say, oh, CME, CE, I bucket that into two different buckets. One, what I have to do, I must do, the requirements, the mandates. And I say, okay, what's the other bucket? It's what I do to learn, to actually do better at my job,
right,
to take better care. And so why are these two different buckets? We want that gap to be zero. There should not be a gap on that. So to us, our vision is really about, ultimately, we want the clinicians to be doing real-time learning as they are working. CME should not be its own thing.
I'm just going to pause you. How does the platform encourage better education?
Yeah.
So I'm thinking about, I used to work with emergency physicians who would always decry having to do like CPR training. It was just one of the check boxes. Yeah. So how does the platform drive better training?
Yeah, great question. So we actually this year, we're planning to launch the first version of what we are calling course recommendations. We have the data on all your licenses. So we are taking that data and saying, hey, doctor, if you take this one course, it'll meet all these requirements. But also, we're starting to take into account the specialty. What are they specializing in? Because something that might meet the requirement but is also relevant to their specialty will be a whole lot more impactful in terms of learning. That's just the start, though. At the end, our end goal really is to be able to gather data that we have about the clinician's preference. What type of patients are they seeing? Get that information from the EHRs, and then be able to make recommendations on what truly will be impactful. And so they don't have to take extra time just to check a box and do CME. Instead, they're learning the relevant material and that is actually having an impact on patient outcomes.
I love it. Last question, what are you most excited about the next 12 months in terms of new partners, new pilots, clients?
Yeah, absolutely. So a new partner, one thing I'm very excited about already is StartUpHealth. We have not just partnered, but we have an actual API integration now, because at Mocingbird, we decided we're going to focus on this niche, because if we try to go across the board and solve for credentialing, initial licensure, it takes our attention away because CME is so nuanced. It requires so much work. So instead, we're very intentional, though, about who we partner with. StartUpHealth also has a great culture, the team, And so we have worked together with them for months at this point, but we have multiple joint clients now, and we actually have data flowing between the two systems on production right now.
I love it. I love it. Sanji, thanks so much for taking the time with me. I'm so excited about the work that you're doing, helping physicians not just gain some of their life back, which is important, but also tackling some of these bigger, thorny workforce issues and education issues. So thank you so much.
Thank you, Logan.
All right, take care.